Today, we're going to talk about some respiratory inflammation and how that can affect your hearing. Dr. Miller and Dr. Weta are the co-owners, and then I round us out to make us a whole team. Our mission is to provide an unmatched hearing healthcare experience, and our values are to have selfless service, selfless staff, and selfless space. So, some really interesting piece that's really important when we're talking about inflammation is good blood flow equals a healthy inner ear. So the organs in the inner ear require a regular healthy blood flow for supply, and good circulation can really nourish our hair cells in our cochlea. And our hair cells in our cochlea, that's how we are able to hear, is these little fibers. Those little guys in our ears, they help pick up sound and transfer it to our brain, and that's how we're able to hear. So that's what those little delicate hair cells are. And the problems that end up happening is that these hair cells don't regrow once they die. So any damage to this part of our ear is permanent. So anything that can damage those little hair cells in our cochlea, that results in hearing loss, and we can't make that better. So once those hair cells go, they're gone for good. Smoking and risk of hearing loss. So the primary smoker, the individual who is partaking in smoking, has a 70% more likely chance to have high frequency hearing loss. Because that affects blood flow, that affects our inner ear, which can damage those really delicate hair cells we just talked about. Secondhand smoke is 2 times as likely to develop high-frequency hearing loss, and young smokers are 3 times as likely to experience hearing loss. So having that smoking start from a really early age is that damage over and over and over to our vascular system, which essentially supplies the nutrients to our inner ear. Starting that smoking earlier in life is going to cause that damage to happen much sooner and for a longer period of time. Nicotine and carbon monoxide lower oxygen blood levels and constrict blood vessels within the inner ear. Our ear is highly, highly vascularized. So this interferes with the neurotransmitters in the auditory nerve. It irritates our eustachian tube, makes you more sensitive to loud noises and more susceptible to developing noise-induced hearing loss. And smoking weakens the immune system. So that can lead to more ear infections, asthma, respiratory infections. So hearing is not just related to our ears alone. It's our entire body really plays an effect on how our inner ear is able to really transmit sound and stay really nice and healthy and viable. Smoking affects others, including our kids. So the auditory nerve is not fully developed until late adolescence, which means that passive smoking puts adolescents at risk for hearing loss. Teens exposed to cigarette smoke are 2 to 3 times as likely to develop hearing loss compared to those with little or no exposure. And secondhand smoke can increase the risk of ear infections in kids. So the more ear infections a child experiences, the higher the risk of hearing problems. So this just kind of plays upon those last slides as well, that it's not just about us. Anybody who is affected by smoking, especially kids, it can really hinder their growth in terms of hearing. Vaping, this is something kind of new to the world. So just like traditional cigarettes, chemicals with vape juice can damage a person's inner ear hair cells, so those really delicate cells that pick up sound. And again, once these hair cells are damaged, they don't come back to life. So the use of nicotine is commonly associated with an increase in tinnitus as well. So some patients come in and they say, gosh, I just have all this ringing. And so one of the questions we like to ask is, do you smoke or use any nicotine products? Because there has been a correlation between the ringing in your ears and use of nicotine. The benefits of quitting smoking can have wonderful benefits for your entire body. 12 hours, carbon monoxide levels return to normal, improving our blood oxygen levels. Quitting for 3 days, breathing starts to get easier, and you experience an increased energy level. A few weeks to a couple of months, your lungs are already stronger and blood flow has improved. And then 5 years, your chances of a stroke are the same as a non smoker. So you are also half as likely to get cancer of the mouth, throat, esophagus, and bladder as you were while smoking. So, some really amazing benefits for stopping smoking, not just related to your hearing, but overall health. Okay, COPD, chronic obstructive pulmonary disease. This is a disease of the lung characterized by chronic obstruction of lung airflow that interferes with normal breathing and is not reversible. Most of us know people in our lives with COPD. It affects around 24 million Americans, and it is the third deadliest disease behind heart disease and cancer. It is tied to smoking, but surprisingly, 25% have never smoked. So, this is just kind of a look at the lungs. On your left side is a healthy lung, on the right side is a lung with COPD. So, visually, just now, you can kind of see the difference between the two. I won't read through all of that, but couple big differences here is on a healthy lung, oxygen moves through the air sac walls into the blood vessels, and carbon dioxide is easily moved into air sacs then to be exhaled. While on your COPD lung, you do get this thick mucus that causes a chronic cough. And I think, again, a lot of us have friends and family that have this, so we're kind of aware of some of those side effects. Airway obstruction leads to lack of oxygen, and hypoxia is a region of the body is deprived of adequate oxygen supply at the tissue level. So I'm going to go back. So any type of oxygen deprivation, you have to remember our inner ear is constantly being supplied by this good blood supply. And so if there's this lack of oxygen, we're not creating a really happy atmosphere for our inner ear to thrive. And so that can lead to hearing loss as well. Sleep apnea. This is an obstruction while sleeping. Gravity and muscle relaxes and allows the tongue and surrounding soft tissues to fall back into the throat area, obstructing airflow. So, another similar piece to COPD is not that good oxygen flow. So, that's where sleep apnea comes in as well, with 31% increased risk of high frequency hearing loss, 90% increased risk of low frequency hearing loss, and 38% increased risk of hearing loss combined with high to low frequency hearing loss. So, back to that oxygen supply, we have to keep those nice blood vessels supplying our inner ear with healthy oxygen flow. Otherwise, it can create that inner hair cell death. Sleep apnea, that it can also cause some inflammation, and loud snoring is linked to sleep apnea, resulting in noise-induced hearing loss, surprisingly. So if you sleep next to someone who is a loud snorer, you can always say, hey, this could be bad for my ears. Environmental toxins. Pesticides, solvents, pharmaceuticals that contain ototoxic pieces to it can negatively affect how our ear functions, causing hearing loss. And it can also kind of affect our balance. Our balance organ is also in our inner ear, called the vestibular system. The risk of hearing loss is increased when workers are exposed to chemicals while working around elevated noise exposure. So that's kind of two-handed there, where you have this toxic chemicals around you, and a lot of times there's also significant amount of noise. So those two pieces together kind of create the perfect storm. Ototoxic chemicals often include painting, printing, building, there are all sorts of things, leather and petroleum products, aircraft maintenance, radiator repairs, fueling vehicles and aircrafts, pesticide spraying, and weapons firing. Those are all just a couple examples of some environmental toxins. And then this is just an interesting graph to talk about hearing in relation, regular hearing checks in relation to other pieces of our body that we check on a regular basis. So 74% of adults get their eyes examined every 2 years. So that's a really good percentage. 62% of adults visit a dentist every year, while only 23% of adults receive hearing screenings. So there's this huge lack of patients coming in and seeing us on a regular basis where our eyes and our teeth are getting checked on a regular basis. So we want to just make sure people are coming in on regular checks just to have their hearing screened or to at least get a baseline hearing test. Okay. Okay. Well, that's all I have. Do you have any questions for me?
No, but I can see why I've lost hearing.
Yeah. Well, I'm so glad you joined us today, and I hope you have a really great 4th of July.
Thank you, you too.
All right. Well, I will see you back. We're going to do this again next month.